About 37 million people are currently infected with HIV across the globe. The AIDS pandemic's killed around 35 million people since the 1980s. Now, a British HIV-positive man has become the second known adult in the world to be cleared of the AIDS virus. He's being called the London patient. Reuters' Kate Kelland has been following the story.
This man was living with HIV. He also developed Hodgkin's lymphoma, which is a type of blood cancer. He became very sick, and 3 years ago his doctors decided to try a last-ditch attempt to save his life, and they offered him a bone marrow transplant with stem cells from an HIV-resistant donor. So the donor's cells had a particular genetic mutation known as CCR5. This is a very rare mutation. It's usually only found in people of Northern European descent, but it is very rare, and it makes his cells resistant to the virus that causes AIDS. This is very significant. The International AIDS Society has described this as a critical moment in the search for a cure. The London patient is the second person ever worldwide to achieve remission from HIV on an extended basis, and it does mean that this is a proof of concept that a cure for AIDS can be found.
The first known case of a functional cure of HIV was in an American man, Timothy Brown. He became known as the Berlin patient when he underwent similar treatment in Germany in 2007. The London patient's doctors said this second case is extremely positive, but were quick to point out that it is not a cure for all.
This can't be done on a large scale. Bone marrow stem cell transplants are very complicated, they're very expensive, and they're very risky. In effect, they can kill you if they go wrong. So this isn't translatable to a wide population of people. What it does mean, though, is that scientists can explore this avenue, this genetic mutation, and focus on that as a potential cure in the future.
Scientific research has led to drug combinations that can keep the complex virus at bay in most patients. This latest triumph may not be the final solution, but medics hope they'll be able to use these findings to explore potential new treatment strategies.